Welcome to She Thrives, Future Aligned. And today I want to welcome Dr. Selena Mitchell, a doctor of integrative acupuncture, Chinese medicine with a breadth of clinical expertise. She has trained across Seattle, San Francisco, and Beijing. Dr. Mitchell's practice is defined by a master level integration of diverse healing traditions. Selena utilizes a wide range of modalities to facilitate deep recalibration using Japanese style acupuncture, the five elements diagnostics, Chinese herbal medicine. So, Dr. Mitchell's education and decades of experience allow her to weave these ancient arts into a powerful holistic healing to maintain harmony and balance in the body. So, welcome, 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 Selena.
Thank
And
you, Ashley.
you're
Wonderful to be here.
And I just want to go straight into these questions, and please correct me with any terminology I might mess up. What
No
led
problem.
you to study classical Chinese medicine, and how is it different from modern or Western medicines?
That's such a good question. Yeah, classical Chinese medicine is really a return to the origins of how Chinese medicine originated back probably over 5,000 years ago. We don't even really know because it's before written record. Um,
Wow.
but classical Chinese medicine is about listening to the rhythms of the earth around us, returning to nature, thinking about how things are occurring both seasonally in the outside world and in other respects in our nature's world, and how it impacts our bodies. So, our internal organs and our systems are very much based in harmony, trying to achieve harmony, finding balance. That's where healing lies.
Yes.
And we see that in the natural world as well. And traditional Chinese medicine, which is an offshoot of classical Chinese medicine, is what most acupuncturists are trained in. I'm trained in it as well to become licensed in California and most states. You have to have training in what's called TCM or traditional Chinese medicine, and that is kind of a more systematic, elemental version of classical Chinese medicine. But the classical end returns back to these ancient texts that were the beginnings of Chinese medicine, really talking more philosophically, cosmically, thinking about consciousness, how we relate to the earth, the stars, the universe, and really not separating our bodies from that bigger, wider breadth. And that's what attracts me to it is time and time again, healing is about finding harmony, finding balance, returning to an understanding of how we relate to the system and how we are part of things rather than separate. So that's really the ultimate reason I decided to study classical Chinese medicine after my more traditional Chinese medicine training.
Right. So it's really bringing in the synergy of the natural world with in our body and our nervous systems to kind of bring balance and harmony, like I said. It's just a beautiful, beautiful, beautiful thing that you practice.
It is beautiful, and when you look at traditional Chinese medicine as it's treated as it's practiced in the Western world today, it has elements of it. It's a beautiful thing in and of itself. But when we step out of that kind of limited scope and recognize our relationship to the outside world and to nature, it's really a return, and I think Western bodies, society really benefits from that return.
Just wanting actually, because some people might not have experienced physically what
Mhm.
acupuncture is. Can you explain the purpose, the reason for the needles? Is that what we call them?
Yes, absolutely. Yeah. The needles, the pins in the UK, they're called pins. But yeah, in our way of understanding them, we look at them as needles. And really, they are conduits harnessing this energy that's in our system that exists outside of ourselves. So if we think about the universe flowing with energy, the same energy that pushes a seed to, turn into a plant and grow, coming from the sun, coming from the earth, that kind of energy or movement is happening in our systems as well. We want to gravitate towards healing. We want to move towards a state of balance. And when we are acknowledging in our systems this energy that's flowing both around us and through us, um, acupuncture points help to harness that. They're like little conduits of energy. They help to move the system. So, really, when an acupuncturist is choosing points, they're helping to kind of shift the flow, help to break up stagnation where there might be energy blockage, help to add energy if there's depletion, help to kind of recalibrate the system through these tools. And acupuncture needles are one way to do it. Acupressure is another way. So invigoration, massage, intention, movement, qigong is another system helping to guide qi through mental intention. But the acupuncture itself is a wonderful way. It's a very efficient way to move energy and empirically very effective. So yeah, it's one of the preferred tools that I lean into, but there are many in the field.
Right. And I've used it for myself when I've had, pain in my neck or down in my back, or just my nervous system was fried to actually just calm the nervous system down. It's an amazing
Yeah,
tool. And, it's got that
truly.
somatic part to it, which, people are calling out for somatic sort of healing. So acupuncture falls in to that mix of helping calm some of the nervous system down. Would you agree or not agree? Yeah.
Absolutely. No, from a physiological perspective, from a biomedical perspective, we can definitively say that science backs that up. So these
Yeah.
little needles, I mean, there's lots happening, some of which we don't fully understand scientifically, but what we do know is that the little disruptors that the acupuncture points create, they're causing a very micro injury to the system. It's imperceptible in most cases. It's not like it's a lot of pain, but it does disrupt the cellular tissue. And in doing that, it directs the body to promote healing to that area. So it's not just, esoterically moving energy, it's actually causing a cascade of healing hormones to be released from the nervous system.
Mhm.
Endorphins, dopamine, all these positive things that flow through our system and are there to naturally help healing. So that's what the needles kind of perpetuate or promote is that flow of positive energy. So you're absolutely right. What you experience is physically palpable in many cases.
Yes. Wonderful. Wonderful. And can you explain the core philosophy behind the classical Chinese medicine in simple terms? You've kind of touched on that, but is there
Sure.
anything else you would like to mention?
Yeah. Yeah. It originated at a time when culturally in Asia, Taoism was part of things. And Taoism has sort of primitive roots, but it also can become quite esoterically philosophical. The idea being that as nature flows, so too does our internal system. So that's the premise behind classical Chinese medicine is if we think of a body of water, moving from everything from the ocean into, say, like if we think about the bay being part of the ocean, and then it flows into other smaller rivers, streams, creeks. I mean, that's happening around us in the Bay Area at all times. Rainfall impacts that. That whole kind of construct of how water flows is one example of
Yeah.
how our systems flow. And Chinese medicine, classical Chinese medicine, pulls from those allegorical, kind of poetic, kind of symbolic expressions of energy and applies it to our body. And then that's really what it's pulling from philosophically. And it really is quite applicable when we're thinking of energy in our systems.
Agreed. Agreed. So we've already touched on a little bit, but
Mhm.
what does the term "she" really mean beyond the common translation? I think
Yeah.
we've already
Yes.
talked about it, but
Yeah, it's really life force is one of the best translations that I've come across. And again, we're trying to translate one cultural understanding of our bodies and energies into our Western world. And sometimes that's a little awkward or a little bit, we don't want to miss anything. So sometimes it requires explanation. And life energy is this idea that we are part of an energetic universe.
yeah.
There's, energy flowing throughout the systems, and we are both recipients of that as well as we add to it ourselves. We too, as a body, are like conduits of energy, and it flows through us and can be accessed. And that's what qi, I think, ultimately is in a most kind of basic sense. And then in Chinese medicine, there are lots of subtypes of qi, different kinds of organ qi, different kinds of immune system qi. So we can get into that if it's relevant.
Okay. And really, it's kind of in our modern world, and as we've grown through experiences, we've got a disruptor, right, of traumatic experiences that impact the body. And then there's a block, right? And then our chi is not in flow, which is why we would seek out acupuncture or massage or other modalities to help with the flow of the chi. Is that
Yes.
right?
Indeed, exactly. Seeking balance, trying to help redirect that energy to a place of healing so that, you know, sort of balance is restored, blockage is unblocked. Yes.
Right. Just looking at my questions. So,
Yeah.
how do you approach diagnosing someone compared to a Western doctor?
Yeah. So Western medicine is really about isolating the problem at hand, kind of bringing it down to the smallest common denominator, trying to, separate it out. Like we think of specialization. You have a heart problem, you go into a heart doctor, they look at your heart organ, they're very focused in this one, realm.
Yeah,
Um, in that way, it's kind of reductionistic.
yeah,
Chinese medicine has the opposite approach. It's really looking at the whole system. So it's considered to be that every organ is interrelated with other organs. There's no one organ that can really operate in isolation. And therefore, we have to treat the system as a whole. And
yeah,
that's true with mind, body, and spirit as well. So although we're addressing the body, we cannot ignore these other forces at play that influence system and energy. So that I would say that's sort of the biggest difference. Now, Western medicine is beginning to really acknowledge that there's interrelationship more and more. There's understanding that things don't operate or exist in isolation. Doctors
yeah,
talk to each other, recognize that, one prescription that affects the heart may also influence the rest of the body. We have to take that into consideration. But that's the premise behind Chinese medicine is this bigger picture, pulling back and looking at the whole system as an interrelated construct.
And do you think if we had acupuncture as a daily sort of practice, something that was just part of our culture, that we would reduce the amount of people that were on medications and had a need, had high, health issues that start off micro, but unaddressed, overlooked, or ignored, become blocks in our system that then create bigger problems?
That's a wonderful question. Yes, I would say that, at least in theory, the way Chinese medicine views the body is that the best approach is preventive. So,
Right.
influence with things like acupuncture and also addressing diet, exercise, lifestyle,
Yeah.
state of mind, how we breathe, all kinds of things, sleep. There's
Yeah.
many factors that influence our system's well-being and finding balance, and acupuncture can be a big part of that. But it's a tool like many other tools. So I would say, lots of other kinds of modalities can be equally as influential and maybe in their own way. But absolutely, if we approach from a preventive perspective before the problem starts,
Right.
if we think about type 2 diabetes as an example, if we wait until we have the disease and then begin to treat it with medication, we've really missed an opportunity. If we started way back in childhood, influencing diet, making sure somebody's, exercise routine was in place, all the other ways in which we can self-care early in life and throughout life to prevent that kind of illness, then we can absolutely change the course of a person's experience when it comes to that particular malady. So, yeah,
Yeah.
I think so.
I think also that, as a practitioner of hypnotherapy using somatics, I find that most people's stress levels, and this is just across the board, like from young people in their teenager experiencing it all the way through to, in their 80s and 90s, stress is the biggest cause of a lot of our health issues affecting our immune systems, our lack of sleep, just depletion in general, because we're working on such high cortisol levels in a nervous system that's completely fried. Um, and I do feel that, I just wish that more people would look at alternatives as a
Mhm.
form of relief from their stress and pain rather than going to a medication that's not going to help you really deal with the real issues, and then it can become quite serious. So it's really like take a breath, spend some money, go and see someone that actually is holistically minded with a practice like yours to help your nervous system regulate, and so that you can actually start to think and feel better rather than reaching for a medication that will only, it's a band-aid, as we say, right? It's just
Yeah,
still going to
right.
be there in the end, but now you're addicted to another drug, and who needs that?
Right, absolutely. No, I think you're right on, yeah, in terms of thinking, Ashley, about the fact that stress is one factor, but we really do I mean, it begs the question about the bigger kind of philosophical understanding of how to live and in our Western world. And in my opinion, a lot does have to be reconsidered because it's not sustainable if we're to burn ourselves out at the pace in which we are expected to be, kind of producing. It's not healthy for our bodies. It's not healthy for the earth. It's not healthy for our whole society.
No, 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 not at all. So, what are the main tools you use, like acupuncture, herbs, and diet? And how do you decide which one to use on your clients? And do you have a niche, I should say, of clients that you see, or is everybody available to come
Yeah,
and
it's a
see?
good question. Yeah, I've been practicing general medicine, so across the board, all
Yeah,
populations for most of my career. I do tend to work a lot with women, especially women dealing with things like infertility or menopausal changes, really about transitions happening in their, menstrual life, in their cycle life, or after the fact. It's very responsive to Chinese medicine, a woman's system, as men too, but women tend to be very connected to their cycle, and that is extremely, that regulation really speak well and is influenced heavily by Chinese medicine. There's a relationship there that is an easy fit. So I would say that that's an area in which I both love to work and very frequently work. In women's health. And I really, my toolbox is I'm trained in acupuncture. I'm trained in Chinese herbs quite heavily. In the Japanese school that I went to in San Francisco's Japantown, it was very herbal focused. And we did several years of learning traditional Chinese medicine, herbs, formulas, how to prescribe. And I work with herbs with most patients if they're open to it. The lifestyle influences like diet,
yeah,
suggesting things like meditation, exercise, mindfulness, breathing exercises. All of those things are relevant. Um,
yeah,
and how I choose is really dependent upon the person's presentation, affect diagnosis, the way that we make diagnosis in my field of Chinese medicine is through pulse and tongue primarily, and then spending time talking with a person about their history, their understanding of their own health, their symptoms. Symptoms guide us. Now, they're not considered to be isolated. They're very much sort of indicators of the bigger system, and that's what I'm looking for. But once I make a Chinese medicine diagnosis, then I can decide what is relevant. A lot of times, diet is quite
yeah,
important to influence, even over herbs. So I may start there because it's a gentle way to really influence. You think about it, people eat several times a day, and that's each meal is an opportunity to impact health, as is exercise. And the modalities just depend upon the individual and both what they express they're interested in, as well as what I intuitively feel is appropriate for them.
right. Agreed. I mean, we are what we eat, and we have to eat in order to survive. So, I agree that food and the types of food that you eat is very important, right? And when you eat it, so many people eat in their cars or at their desk still working. So bad for your digestion and your overall health. It's like, no, you can take 15, 20 minutes to go and sit in a quiet area, uninterrupted, to ingest the food that you have bought, right?
Absolutely. No, if we think of
You
it as
don't have
how,
to, right? It's like, no,
yeah,
make it a priority, make you a priority, because you
yeah.
need to just balance that and slow it all down.
Right, right. And it really comes down to intention, which I think is a big part of healing as well, is that if you are setting the stage to receive the food you're eating in a calm manner, your whole system is able to reciprocate, be a part of that. But if you're rushing, where is the blood flow? It may be in your brain because you're driving, as you're saying, or if we're under stress, cortisol, as you were mentioning, really influences things like digestion. So that alone, then that's a very simplistic way to explain how we are impacted by the stress that we might be a product of or a perpetrator within, but we have to
Well,
take
it's the
action.
environments where we're having to live up to, right?
Yeah, that's a whole other discussion.
Yeah.
Right.
So yeah, it is changing, trying to help educate people that, oh,
Yeah,
let's not run
right.
like machines. Let's walk like we are humans, right?
Yeah, finding balance. Exactly. We are kind of under the construct in which we live as Westerners, we're really about survival. Like we're all trying to survive
Yeah,
because, if you don't produce, then there's not a lot of cultural net to hold us here in this world. So it's not our imagination that we're all racing to some finish line so we can, you know,
retire.
survive and exactly not be, working when we're 90. But that is sort of how our system is developed. So it's not like I like to make sure clients and patients understand that we're not it's not our imagination. It's not like we are at fault because we're operating this way. We are
Right.
really part of this culture that is a diseased culture. I mean, we are expected to just pull ourselves up from our bootstraps and work 60 hours a week without a break in order to achieve the glass ring, which is like some kind of success. And if we can slow down and really appreciate our bodies and recognize that we are taking care of ourselves on this most basic way and how impactful that is. Ultimately, it leads to greater production if we're well rested, if we're healthy, if we're balanced.
Yeah, beautiful. Because we only have one body, right? We
Right.
might have multiple lives, but we only have
Sure.
one body. So be good to it. Good to it.
Exactly. It's our vehicle. It's true. It is related to the rest of us, our spirit, our emotional health. So,
Yeah.
yeah.
Well, I want to say thank you for spending the time with us, for giving us such a wide breadth of understanding of acupuncture and herbs and the benefits of it. Is there any last thing you would like to say in regards to the work you do to try and encourage people maybe to try it? I had an experience where I went into an acupuncturist. She did tell me to not drink coffee, to make sure I had some food and plenty of water. Well, I didn't quite follow those rules because I was in my 20s and I was full of
Sure.
piss and vinegar. I'm like, oh, there's no big deal. I lie down and she's a beautiful practitioner and she puts in all the needles and I'm lying down and she goes, okay. And, she stays with me for a minute, then she leaves. And then I start to imagine that the needles are about 10 foot high and that I'm trapped and, maybe they're penetrating when I completely freaked out. She came back in. She's like, how you doing? I'm like, take them out. And she did. And we laughed. She said, how much coffee have you had? Blah, blah, blah. And then she gave me some water and then we did it over. And I went into the deepest sort of sleep
Mm.
because my nervous system was calm. Like the pulsation of the needles was just, and then I became kind of addicted to it. I'd go every week and she's like, do you actually have something wrong? I'm like, oh yeah, it's a twinge right here.
Sure. Right. Right. No, that's wonderful. What a wonderful story. Actually, that's beautiful. And I'm glad you had that experience. Somebody who was able to meet you where you were at that time. And
But there is some preparation to it, right? You
yeah,
do want to, yeah.
yeah, exactly. Respecting your experience and being able to accommodate and sort of pivot, give you a chance to express how it really felt. And so, yeah, that would be my advice is just have an open mind when going in and recognizing that self-compassion, your skepticism, anyone's skepticism for the first, if they're getting acupuncture for the first time is absolutely healthy. It's a good idea to be, constructively critical and make sure that it's working for you and whatever you experience is okay. But I'm so glad you had a practitioner who was able to, evolve with you and help you through it in the way that she did. It became a good thing.
Yes, I went regularly. I loved her. Yes.
That's beautiful. I'm glad that you had that experience.
Yeah.
Wonderful.
Thank you. Thank you. And
Oh, thank you, Ashley.
we'll have you on again with more information about your beautiful work. Everybody,
Oh,
take care, and I'll see you soon.